Hey guys, it's Andy Austin. I'm a nurse practitioner specializing in interventional pain management for the last 19 years, helping people every day with chronic and acute lower back pains. We've been putting out these little instructional videos that hopefully you'll like it and learn some things and hopefully help you deal with chronic back pain in your day-to-day lives, or hopefully prevent it. Today's a perfect day. We're going to talk about axial lower back pain with prolonged sitting. And the reason why it's perfect, it's summertime, people are going to be traveling more, that requires more sitting, be it in a car or airplane, train, wherever. And people that have chronic lower back pain as it is, they know and they have this fear of a pain flare up whenever they're going to their destination and possibly ruining their travel plans because they're out, because their back's out. So we're going to give you 3 things that you can do to lessen the chance of having a pain flare up and ruining your trip. If you remember our last talk, lower back pain that's coming from a disc or discogenic lower back pain, we're going to follow the same kind of thread. This is focusing on pain flare-ups, particularly around discogenic lower back pain. So if you remember that, the disc is made up of 2 parts, the nucleus and the annular rings. If you haven't seen it, go back and watch it. You'll know what I'm talking about because we go over the anatomy some. But anyway, the disc allows the spine to bend and flex and move, and also it acts as a shock absorber, axial stability for the upper body. So when you're sitting, say, in a car for a long time, that's where it's under the most pressure. The discs are under the most pressure. And so that's thing 1 is no prolonged sitting. And I know it's hard, you want to get in the car, you want to get there, but if you follow these little tidbits to prevent that disc from becoming irritated and releasing chemicals that your body detects as pain, that's going to save your trip. So this little graph here shows your usual, now I'm not an artiste, okay? I don't want any comments, I'm not Picasso here. But this is your front, this is the back, this is the vertebral body, this is the bone, this is the other bone. In between there, blue's the disc. That's what we're talking about, okay? That's where all this is happening, okay? That's where your pain's gonna be coming from in discogenic lower back pain. These little wings back here are facet joints. Those are the joints. They come on the back side of the spine and lock together, okay? And this little green dot is, if you're looking this way, of a nerve root, and that nerve root comes out and goes down your leg. A lot of people call it sciatica, and that's one of the nerve roots that we're talking about here. So the blue's the disc, okay? So if this side here is just normal supine anatomy, nice, juicy, fluffy disc, people have had probably in their late 30s, early 40s, they've had maybe a flare-up or 2 where their back went out. Again, go back and watch that other video. We talked about what caused that. But they don't have any lower back pain unless they do something like sit in a car for several hours. They'll really set it off, okay? So that's kind of what you're looking at. Good disc height, good space around the nerve root. Everything's fine. This is what they're lying flat on their back, okay? So gravity is going this way, the green arrow, okay? So that's supine or laying flat on their back, okay? So you put them in a car, okay, and with poor posture or even average posture, I hate to tell you, most people have awful postures, okay? What that does is if they're sitting up, sitting forward with a forward lean or in neutral position, all the upper body weight and gravity is coming straight down and it's putting more pressure on that disc, okay? And it'll compensate for a while. But say if you're in the car for 2 or 3, 4 hours and all of a sudden that disc starts locking up, that back starts locking up, that could possibly very well be the disc, okay? And then you're looking at minimum a couple days of a lot of lower back pain to get over, okay? So our plan here is, the first one's avoid prolonged sitting, okay? So if you avoid prolonged sitting, when you're on your trip, okay, this is what we tell people all the time. When you're on your trip and you're in the car, the goal would be, say, for every hour to hour and a half, just stop and get out and walk around 10 minutes or so, okay? Don't wait till your back starts talking to you, okay? If your back starts talking to you, it's already releasing those chemicals, okay? It's already ticked off. So we want to keep it from getting ticked off. Or if you have chronic lower back pain, we want to keep it from getting more ticked off, okay? So the plan would be every 1 hour to hour and a half, just get out and walk around at a gas station or somewhere about 10 minutes. You're reestablishing this, you're getting pressure off that disc, okay? You're getting circulation going in your lower extremities, which is always good. And then you're able to get back in the car after the 10 minutes or so, reposition, and go on about your business for another hour, hour and a half. Now, I know it's easier said than done, but trust me, an ounce of prevention could very well possibly save your whole trip. And how many people that have had lower back pain hurt their back on the way, and they stayed in the hotel room the rest of the time, the rest of the family had a good time, okay? We don't want to do that, right? It's too much money, things are too expensive. So just do these little things if you can, and you'll be better off for it, okay? So this is if you're sitting the incorrect way, okay? Another way, step 2, is when you're sitting in the car, you don't want to sit in a horrible posture, okay? Where you're putting maximum pressure on that disc. What you want to do is get in a slightly extension, okay? What that means is shoulders back, and just in a little, you'll feel it. If you lean back just a little bit, you'll feel those facet joints lock, okay? They'll engage, okay? And that's what you're doing. And when you go just a slight, maybe not even 10 degrees or so, an extension, you're putting more pressure on the facet joints, and you're taking pressure off that disc, okay? So if you don't have facet joint dysfunction, and you're protecting that disc, okay? So you're in a little extension. It's easy to do that. They have things that you can buy. I have patients that call these their butt pillows, okay? They put it down there and it helps them kind of get in that extension, shoulder blades against the seat in good alignment, taking the pressure off that disc. Also too, easy thing, simple towel roll. If you're going to the beach, you got a half a dozen towels, beach towels, just wrap one up, put it on the lumbar spine, down to the lumbar spine, and that'll give that little bit of extra extension. Now I know all the cars now have lumbar supports, and that's great, but a lot of them do not give you enough, or the person doesn't sit properly all the way back against the seat, but always the back to the back of the seat. So the towel roll, or the butt pillow as they call it, is very helpful in maintaining this slight extension, maintaining proper positioning, okay? And it's gonna save a lot of wear and tear on that disc. What a lot of people don't understand is, particularly in the younger folks, say the 30-year-olds and 40-year-olds, they're the highest risk for having axial lower back pain coming from a disc, okay? Because they haven't lived long enough to start developing facet joint dysfunction. In most people, okay? You have some other outline, and I'm sure people are gonna comment, oh, you know, I got some facet joints, fine. We're just talking purely academic standpoint. We're talking about discogenic back pain, okay? So if you put more pressure on the facet joints, less on the disc, you're gonna come out a whole lot better, okay? And this model will show you, this is the same thing as I drew up there. This is front, this is back. In fact, you can feel the bumps on your back when you rub your back. And these are the facet joints, right? This is the disc. These are the little nerve roots, okay? So if you're sitting normal, okay, and you're maintaining putting maximum axial pressure on that disc, okay? Now, if you go into just a little bit of extension, watch that disc right here. Watch that disc. Watch what it does. There it is. You see that? That's what you want right there. You want just that little bit of pressure off that disc and you're putting it on those facet joints, okay? That's it. That's it. That'll save you a whole lot of headache. Third thing, and this is a great thing when if you know you're in the car and you're starting to have the back start talking to you, it's starting to get stiff, it's starting to get tight. Rotation is not your friend. You do not want to rotate. Forward flexion and rotation is all on the discs, okay? So if the discs are upset because you've been sitting on them for 2 or 3 hours, the last thing you want to do is put greatest stress on them by rotation, okay? So when you're getting out of the car, I tell people where the hips goes, the shoulders go, and vice versa. Where the shoulders goes, the hips go. So you keeping your body in alignment when you're sitting. Rotate out the car. In other words, just don't rotate at the body. Rotate at the waist. Rotate the whole body, and get up out the car that way. Okay? Because the worst thing you could do is get to your destination, get out the car and rotate, and your back goes out. I've had it happen to dozens and dozens of people. So those are some little things that I've collected over the years that's helped people. I hope you enjoyed it. I hope you learned something. I hope you have a great vacation wherever you're going. Heavens knows we all need one. Stay safe, protect your back, walk. If you're going on a vacation and you haven't, and that's going to require a whole lot of walking, like some of these amusement parks that you walk 8-10 miles a day, train for it. You want to enjoy it. You've paid good money, so go train for it about a month or two ahead of. Good proper shoes, okay? Have a good time. Be safe. Use your good common sense. Plan your trip. You ain't got to get in a big hurry. A little prevention, getting out, walking around will save you a lot of headache down the road. And that's it. And I hope you enjoyed it. If you like it, subscribe, please. Let us know in the comments what you liked about it, what you didn't like about it, other than my art. I'm not an artiste, okay? Well, listen, thanks for watching. Tell your friends about us. And we look forward to you coming again, seeing us next video. All right? Have a good one.